What if your private practice was a space for your healing and growth too? What if we could move our practices from a stress-driven business model to a practice that grows as we thrive? What if we become courageous leaders and agents of change through our practices? Join us as we explore the journeys of inspiring psychologists who are healing through private practice. Hello and welcome to this episode. Today, the episode or the title that we're speaking to is Safe Spaces, Creating a Practice When You Identify as Part of a Marginalised Community. And I've really been looking forward to this episode, but also with a kind of sense of trepidation because I think it's such an important topic for us to talk about. And I think it's also not necessarily an easy topic to kind of work through in our private practices. But I know from my own experience, and I know from working with other psychologists, that, when we think about this whole topic of why do people go into private practice, it's a very real situation that some of us go into private practice because we need to create a safe place and a safe working environment for ourselves. And that's sometimes because of our own experiences coming from different kinds of what we might call marginalized groups or communities. And it's not necessarily the case that we come into private practice in order to then directly serve that community. But sometimes there are aspirations or questions about what we can do as psychologists to then act in service to kind of the community that we're also part of. And I think that raises a lot of questions and topics. So here I am today with Dr. Aneesa Shariff and Dr. Melody Smith, who are both clinical psychologists, but coming from different backgrounds, both professionally and personally. Welcome to this episode. And what I would love to invite you to do is introduce yourselves a little bit more, also introduce your practices, and then perhaps share whatever you're comfortable with about your own story in this area. So if it's all right, can I come to you first, Aneesa?
Yes, definitely. Thanks, Wendy, for having me on today. I'm Aneesa, and I recently started in private practice 6 months ago. In my private practice, I specialize in working with professionals who are dealing with anxiety, burnout, and trauma. But in my supervision work, I specialize in providing clinical supervision around issues of providing culturally inclusive therapy and cultural issues as they play out in the therapy space.
Right.
So that's a little bit about what I do now.
Yeah.
And so, in terms of kind of the backstory of how I landed in private practice not too long ago. So, as you can tell from my accent, I'm not from the UK. I am from Canada, grew up, trained in Canada, worked there for a while, and then moved here and was very excited to get my first NHS role. And the department was very excited to have someone from a different ethnic background because our trust served a lot of patients from a South Asian, Pakistani Muslim community, and I identify as a second generation immigrant South Asian Muslim. So they were very excited to kind of increase their diversity. I was excited to be there. And then slowly over time, I guess it was quite a learning process for me to adapt to a very managed system. And that was kind of not what I was used to working in Canada. It was very collegial once we were qualified. Whereas within the NHS system, it was very hierarchical still. So that took a bit of getting used to. But then also, I just started to notice discrepancies in how I was received when I would start to want to talk about career progression. And so it was very much met with kind of just, no, you're not, you're in your banding, you're not paid to do that kind of work. So it was very much a stay in your lane type of message rather than inviting conversation, especially as I was kind of working in a lower banded role, having not had the NHS experience prior, even though I had years of qualified experience in Canada. And then I would get a lot of verbal feedback that was very positive around my leadership skills, wanting me to provide presentations on culturally inclusive therapy, racial microaggressions, wanting me to serve as a BAME interviewer on the interviewing panel.
Right.
But then blocking me from and discouraging me from applying for promotions within the department. So a lot of assumptions were made about me when I would express interest in these roles around lack of experience when they hadn't actually asked me what my experience was. And so I was learning that there was a lot of discrepancies, and it was really confusing for me. I couldn't really make sense of it at first as to why it was being received in that way, why other people with less experience were being actively supported in their career progression and I wasn't. And so it was a lot of emphasis around this tokenistic kind of representation. I was a person of color, I was the right color, and they needed that representation within the department. But then I was very much being sidelined or, further marginalized in a way to kind of, you're kind of about bums on seats. You're not kind of about going into a role that where there's leadership and more of a central role in things. And it kind of felt very confusing. I felt very used at the time, and it took me a long time. This was a 2-year process for me, probably about a year before I started to really understand, after having had some conversations with people, and it was named that this was actually systemic racism. It was very subtle. It wasn't this overt kind of racism or discrimination, but it was a subtle kind of subversive blocking, and lots of stereotypical types of assumptions were being made, assumptions about my experience. When I was asserting myself and questioning that with the people, they would backtrack and say, well, no, it's not about experience, it's about skill. When I would highlight my skills, they would backtrack again. And it was this kind of really confusing process. And it was quite a shock to me. It took me a long time to really recognize what was happening in that system. So that's kind of the
Yeah.
backstory of, where I was before I entered private practice.
Right. Yeah. And I'm going to, so thank you for sharing that. And
Mhm.
I'm going to come back to then the kind of pivot to what led to private practice. But I want to come to Melody first and kind of ask the same question, please. A little bit of an introduction into your different practice areas and then also into kind of your story.
Thank you. And thank you so much for having me, Wendy. So I'm Melody. I'm a clinical psychologist. I qualified in 2019, born and raised in London. So really intrigued to hear more about your experience, Aneesa. At the moment, I am working, I specialize in working with primarily young people with neurodevelopmental conditions, so autism and ADHD. And in my private practice, we provide some assessments, but we also provide parenting interventions and parenting work to support parents who have children with autism, ADHD, but also present with behaviors that challenge. And by that, I mean kind of physical aggression or verbal aggression, but also difficulties around kind of tasks that we need to do with children, like getting them ready for school and brushing teeth and things like that, that as parents we just have to get through, but we want to do them with a little less resistance, but also kind of highlighting that we don't want it to be kind of a forced thing for the children and for it to be a dictatorship. So I support parents and young people around that. And then I also am the director of a company, an organization called Aspiring Clinical Psych. And the remit of the company essentially is to support aspiring psychologists who, as it says, want to become clinical psychologists, but are coming up against those typical stumbling blocks, career confusion, anxieties around applying and knowing whether it's the right time to apply and whether they have the right skills, but also supporting them to and empowering them really to talk about their own experience and reflect on their own experience. And so we provide a number of different kind of offerings and services. So career coaching, but also live events. Reflective workshops, journal clubs, and we have an online course as well that supports aspiring psychologists to really illuminate the competencies of a clinical psychologist, which quite often they have in some degree, but maybe aren't so conscious of those amazing skills that they have. And of course, in order to become a clinical psychologist, it's so important to be able to articulate what we can do. As Aneesa's already mentioned, sometimes we can come up against real resistance in terms of being able to move forwards in our careers. And so supporting aspiring psychologists around that. Sorry, I've got something in my throat, so I'm just going to clear it. Excuse me. So that's a little bit about what I do now, and I spend at the moment the majority of my time working in clinical practice, and about a third of my time working with aspiring psychologists, with aspiring clinical psych. And I think really I started branching out from NHS. So when I qualified, I went into a learning disability team within the NHS. And of course, we come across a lot of neurodevelopmental conditions, and I absolutely enjoyed that work, which is why I still do a lot of it, really. But while I was working there, kind of came from I'm going to say kind of a wounded healer kind of position in terms of building aspiring clinical psych. Training for me was really, really challenging. I'm a Black woman in an environment where there aren't a lot of Black clinical psychologists, and so really felt it was important to not only try and do something to support aspiring psychologists like myself, or even people that are different to me, to feel more empowered and confident about progressing towards the career, but also wanting to kind of provide spaces to prepare them for the challenges that are inevitably going to come for all aspiring psychologists. And so started out kind of building that in 2020. And around the same time, became a mother for the second time, and realized that being a mum of two, working in the NHS is very challenging. Not only because of sleepless nights and school runs and homework in the evening, but also in terms of needing to work part-time and not being financially in a position where I can make decisions and choices in the best interests of my family. So that was kind of the straw that broke the camel's back, really, not feeling as though I had time to really focus on my family in addition to working within the NHS. And unfortunately, I say unfortunately because at the time I was really sad to leave the NHS, but I felt that in order to be able to work more hours and earn more money, I needed to put my daughter into childcare earlier than I had hoped to. And that was going to eat up most of the money that I was going to be making in terms of kind of having choices. And so really felt backed into a corner, really. And had that rude awakening of, in order for me to be able to live a life that's fulfilling for the next few years, something has to change, something has to give. I need to be able to sustain myself and my family, or at least my part of my family finances, in a shorter period of time. And private practice made that possible for me, in alignment with working with aspiring clinical psych as well, which I was doing most evenings, in addition to working part-time and raising a family. So I just find that working in private practice has enabled me to have more ownership over the time that I do have, so that hopefully, I mean, as much as possible, it's not quite materializing at the moment, but as much as possible, I can give more time to my family. And certainly I do have more ownership over the time that I spend working now. So that's a little bit about me and where I'm at and what led me to private practice.
Thank you. And what I also kind of note with that something that kind of brings to mind some elements of my own journey is the ability to also, and Aneesa, you also kind of referred to this in the work that you do in your private practice, which is being able to also bring work in that is purposeful, that has kind of meaning and purpose behind it, particularly because of own lived experiences. So there's an essence of being able to deliver work, but not having to. I think that's something I observe a lot as well. You know, sometimes when we're working in areas where we're trying to support people who have experienced oppression and marginalization, that when it's in areas that particularly touch our own lives, if we do that all the time, it can feel very it can feel a lot to hold all of that space all the time. And at least then within private practice, you're also empowered to right size that support that you offer, so to fit with where you're at and what kind of emotional or psychological bandwidth you have for that at the time as well. Just to kind of share and be a little bit kind of open with people about my own experience in this area. So, and I mentioned this to Aneesa and Melody before we started the conversation as well. So my own experience of being part of a marginalised group is the marginalised group of people who are care experienced or adopted. And so, just to kind of put that in a nutshell, I gave evidence last year to the UK All-Party Parliamentary Committee for Human Rights. It's a very long title because there was a quite in-depth inquiry into the human rights violations over the right to family and for the forced adoption era that happened after the war and up until the end of the 1970s. And that meant that people who were not married or whose face didn't fit just literally had their children removed from them as early after birth as whenever. And then there's a cohort of probably about, at least 185,000 of us in the UK alone who then, had our original identities hidden from us, who were absolutely severed from our families, who were kept in these very closed, it's literally called closed adoption. And the difficult element with it is that it's often, but not always, an invisible form of marginalization. There's a lot of intersections with other experiences. But at the end of the day, it's an area for activism, and it's an area that kind of impinges or intersects with my own practice. It's something that is often overlooked and negated as being on the receiving end of a system of oppression. But what the Human Rights Committee very much revealed in their report was that this was very much a system of oppression that had been operating. And we can talk about that across the kind of different parts of the world. That led to a change in the law, because one of the last vestiges of this system in law in the UK was, it's not the only, but it was one of them, that in law, you could not offer therapy to adopted people, even adults, unless as a psychologist or psychotherapist, you were registered with Ofsted, which is the Office for Standards in Education, as a registered adoption services provider. And that meant that there were very restricted numbers of therapists available for adult adopted people. What that meant for me as a psychologist, I don't offer therapy, but I was also very wary of ever offering even coaching or any kinds of services to people. I know, for example, that this intersects with people's the way in which we show up in our businesses and the way in which we show up at work. And so thinking about how we kind of support people to move forward in terms of their work and their working lives, which is, my thing as an occupational psychologist, I was absolutely determined that there was no way I would even go near that until the law was changed. And then ultimately, the law has only been changed in December of last year. And so now anyone who is a psychologist can offer therapy. It's not my intention to offer therapy. But one of the questions is, for me, what could be a way of supporting people who I know are living without many services and often overlooked? So that's kind of also a little bit my interest in this topic, because as a psychologist, it sometimes feels really difficult and uncomfortable to navigate my way in a profession that has, and sometimes does, still play a role in upholding a system of oppression that I've experienced. And I'm just wondering about what your perspectives are on some of those elements as well. It's often very multi-layered and so on. But Aneesa, I saw you were kind of nodding your head there about that.
Yeah, I think it's so interesting, isn't it? Sometimes even the ethical and moral dilemmas we have, psychologists can be part of an oppressive system in that way, even though that very much goes against our standards and values. And it's such a tricky place to find ourselves in, and I think can cause a lot of moral injury as well, especially.
Yes.
Moral injury once you recognize that you are working within a system and formulating that system as oppressive. But when you're not able to see it in that way, it can be quite a different situation as well.
Yeah. Exactly. So, coming back to your own experience of that, what were some of the pivotal moments that led to you deciding to shift your relationship with the practice of psychology and kind of legally move out of that? Legally meaning legal structure, out of a job or employment and into private practice.
So for me, I think the pivotal moment of this kind of 2-year journey I was on was when it was actually named by the EDI manager in my trust and the department head as systemic racism. And I had never used those words. And actually, I was quite naive in that way, even with all the previous research I'd done in microaggressions and things, that I wasn't actually able to see it when it was happening to me. And so when that was named in that way, I actually felt relieved. I felt shocked. Um, and then I thought, okay, things can change, and then nothing changed. So that it was
Yeah.
named, and the people involved were never called to account for their actions. Nothing was ever facilitated in practically supporting me to address those issues. And so the behaviors continued, very subtle behaviors, around being ignored, being excluded from meetings, having the scope of my role reduced. And it finally came to a head when I said, enough is enough. I felt like I had to remove myself from that system to keep my mental health intact, because I was so demoralized at this point. And I felt really victimized by this point in time. And I'd never
Yeah.
seen myself really working outside of the NHS. I really valued being part of that system. So I kind of, in a way, felt forced into private practice at first. But the week I went live with my private practice was the same week I kind of drew a line in the sand and handed in my notice. And that was very much against my original plan of slowly building private practice up alongside that
Right.
stable employment. But it had just gotten to a head where I just felt like I couldn't continue to put myself in a situation where I was really being used and felt very exploited by this point, when people were being enabled to continue these behaviors. So I very much started my 3 month notice period. And, you know, that for me was a defining moment, really, where things started to turn. That I had to make a choice, that was actually the courageous choice for me, rather than to kind of escalate things. Was to actually put my energy into giving myself the opportunities that others were kind of not supporting me to take, and to step away from this kind of tokenistic system of, well, we need more diversity within our workforce,
Yeah.
but not when those people want a leadership role and are qualified to deal with that. We want them, but we want them on the sidelines, or we want them as BAME interviewers or other things. So for me, that was really the point at which things started to change. And it was really scary making that
Yeah.
leap, especially so quickly. But I think it just
Mm.
came to that point where the pain of staying in that system and allowing myself to feel disempowered was worse than the fear and the uncertainty of leaping straight into the unknown and
Right.
potentially empowering myself in the process.
Yeah,
Yeah.
exactly. And yeah, Melody, and I'm just reflecting on what you were saying about both being a Black woman trained as a Black woman, Black female clinical psychologist, and also then this kind of these layers of messages, which were, we have policies about flexibility for motherhood and flexibility for, looking after children and so on, and not
Yeah.
necessarily very flexible. And you know, what one would hope would be an aspiration to retain more people who, were more representative. So
Yeah. Yeah.
what were any pivotal moments for you around that?
Yeah, I mean, I think what Aneesa said about the moral injury rings so true for me. And I think what
Mm,
really, and microaggressions, because I think really, you know, what that makes me think about is that often we go through these things and they have such a huge impact on how we feel. But because people aren't, it's very difficult to articulate what's happening because it's so complicated, the, overlapping between the things that are going on and how they're impacting us. What I found is that it's difficult to find support and difficult to find people that can truly name what it is that's going on. And so I found that there was a compound effect over time. I think that there were a couple of pivotal things that happened for me. So, for example, obviously we all went through COVID and we were working from home a lot. And actually, the fact that I was working from home a lot made it possible for me to have a bit more balance. But of
yeah.
course, we went back to working in a slightly different way. And, mostly I was okay with, changing the way that I would work. But I think that there was pressures to do it in a time frame that wasn't really feasible considering childcare arrangements and all of the things that I'd set up in order to be able to go back to work in the first place. There wasn't so much empathy around kind of what it would take in order to unravel some of that and then put new plans into place. It was kind of like, well, this is what we expect, and so this is going to happen in 2 weeks' time. And
Mm,
I found that to be deeply, deeply wounding for me because it not only shook up everything that was happening and that I was relying on to remain constant for a period of time so that I could be at work, but it also just felt like I was disconnected from the people that I actually felt quite close to at the time, working
yeah.
with. And that was really, really a sad and rude awakening for me. But I think, actually, one of the one of the things that I think, throughout training and just throughout my qualified practice that I feel I was doing is an element of masking in a way. An element of not really bringing the whole of myself to work, and that was chipping away at me slowly as well. So when those bigger situations happened where things are being changed, or and I felt like I wasn't being empathized towards, naturally there was a part of me that wanted to kind of break free from that, because actually I was holding on to quite a lot, and that extra bit just tipped me over the edge. But it would seem completely out of character for me to act out about it, because I'd been masking how difficult or how myself for a long time. So yeah, it just felt like I couldn't really bring my whole reaction to that. I felt a bit disingenuous, which layered on top of that is this idea of the imposter syndrome, and the imposter that we all have an element of. But as people from so-called marginalized backgrounds, there is always I feel like there's just a thicker layer of that happening that really maps onto that kind of masking behavior that I was talking about.
Exactly. And one of the things that is I was kind of making notes as I was listening to you about, this topic of moral injury, microaggressions. Aneesa, I think as you were talking, I wrote down that it's kind of a surreptitious system. As you said, there are these kind of little ways in which, and I think Melody, you alluded to it as well, small ways in which a system enacts itself that that lead to certain outcomes, but almost like, well, what I've written is it's in the interest of the system to kind of hide itself, right? It's like a wolf in sheep's clothing. And
Yeah.
I think sometimes, like, these systems of oppression, these systems whereby people's identities are exiled, parts of their identities need to be exiled in order for them to be present in that system, where their power is reduced so that they can't challenge that system, where, and that system relies on the rest of us becoming complicit. And therefore, it allows us to have those little cloaks of invisibility as well, because then we're able to kind of enact it. And I mean, what you said there, Melody, that really resonated with me was this element of masking, and how it gets to a point where you can't continue to hide those parts of yourself, or to be squashed down by the system in that way, to have those parts of yourself kind of exiled. And it was a similar thing for me. I'd never talked about, I never thought that this topic of flipping adoption would come into my work as a psychologist. Yet when I'm working a lot alongside clinical psychologists, and I'm getting involved in, or I'm at least observing or witnessing discussions, and I'm like, that's not even how it is from the inside. Like, what about all these other questions that come up? And then, as you said, Melody, when you speak out about it, in fact, for both of you, I've had both those examples. So either the system has come back and like, what you're talking about, who are you to talk about this, etc. Or, Aneesa, people will kind of go, oh yeah, that's a good idea. Oh yeah. Oh yeah, we can name how that's a problem, but there we go. We're just going to carry on doing it. And it just blows my mind.
Yeah, absolutely. And I feel, I don't know, sorry to jump in there, but I feel like
Please
it comes in so many different shapes and forms, because I think, I would like to say that working in private practice, I haven't experienced that, but it's not the case. I think, working with aspiring clinical psych, I think that I don't know, people don't like some of what I do. And what I've found is that people will throw legal structures at you.
Right.
And that's very scary. It's very scary. It's threatening. Nobody wants to receive, correspondence from lawyers, not less lawyers of large organizations. And really and not even just that, but also we market ourselves online, and there are trolls and people that just say and do nasty things. And this is all part of a similar kind of system, whereby at the end of it, part of my training and part of my registration and part of who I am is to operate in a way that I'm doing what I'm doing with integrity, and to suggest that I'm doing otherwise is just awful. So that's also come into play, and having to navigate that as somebody who isn't financially privileged, who doesn't necessarily, okay, I've got decent education behind me, but I don't necessarily have lots of finances or lots of people in places that can advise me in that way. So it almost felt a bit like bullying, when actually, in terms of legal structures, pretty approachable. Actually, I'm on every social media platform you can imagine. Ask me for my email address, you can have it, and we can have a conversation. But instead to kind of it's felt like, to kind of throw their weight around or to make a point, they will throw legal structures in the mix. And I just think, well, that's nice for you to have that, available to you. And what can I do? Just have to respond.
Yeah, exactly. Yeah. Aneesa, you were talking there about also moral injury, and I'm just thinking about the work that you do also with other health professionals around that. Is it similar thing where, what's been your experience of kind of moving into that area of work, and how how you continue to witness some of this stuff, or how you feel as though you can make a change in that area? Yeah.
Well, I think in terms of, when I think about the type of training that's available in doctoral programs for providing culturally responsive therapy to clients, I think it's quite a mixed bag. Some programs provide very little, and for some, it's a series of seminars. And I think what they all have in common is that they're very, from what I have heard anyways, intellectualized. So they're very, even the ones that I used to give in my department, they were very much presentation based.
Yeah.
And what we really need is to reflect on our own worldviews, our own biases, our values, and be very conscious of us, of ourselves, and what we're bringing into the therapy space, because we bring our worldview with us, and it's very easy, if we're not really aware of how culture bound these things are, to project it inadvertently on our clients. So I think there's a lot more need for that reflection and consciousness raising part in kind of training programs today, and also just skills based. How do you adapt the therapy models that are, again, they haven't been developed with marginalized communities in mind. And so the people who are now coming to therapy very courageously, they're overcoming lots of cultural stigma to access therapy for the first time in ways they might not have a generation ago. If we're not providing a safe space for them where they can reflect on their values, where they can bring in their cultural and religious, spiritual beliefs and practices into the therapy space, which is what I hear a lot from my clients, actually. When they've had previous therapy experiences, by the time they've come to me, they've often been around the block a few times and found it not as helpful, because they've had to shy away from talking about religion or talking about culture, or worse, they talk about culture and it's stereotyped, or perceived in a certain way that's not helpful for them. So I feel like as well, we need the skills based. How do we adapt assessment practices? Most of our assessment tools are not normed on people from diverse populations. So there's a lot of adaptations that sometimes, are very easy to overlook. But very important for making it part of a safe space. So a lot of the work that I do in supervision is around these deeper levels of making your practice culturally responsive, inclusive. And it's not just about, bringing in an interpreter or going to a CPD for an hour or two. It's really about grappling with these issues, reflecting on yourself, and developing the awareness of adaptations and cultivating that safe space. So, right from the first assessment, you're able to freely ask clients, do you have any spiritual, religious, or cultural beliefs that might be coping mechanisms for them during times of difficulty and distress? And so they're getting that message right from the initial contact. So these are kind of some of the ways I try and bring that into the work that I'm doing now in private practice.
Yeah, and I'm curious with that about your perspective on how this idea of validating approaches, like which approaches get validated and which approaches don't get validated. So obviously what we do within inspiring psychology practices is we work a lot with practitioners to help them diversify their products and services. And I'm very much of we have a design school within the program that we run, and it's very much about designing products and services with the people that you're serving and not just doing it to them, because there's been a lot of history of us as psychologists generally doing psychology to populations and forgetting certain groups and communities, just completely overlooking them. And, a lot of research getting done on male white college students. I mean, that's almost like infamous now. But I'm curious because what you're describing there to me sounds like, first of all, I love this point of yours, which is let's get out of the intellectualization and get into the embodiment of what this practice looks like, what a culturally sensitive practice looks like and feels like in practice. And then the thing that comes up a lot from my clients is if I do things differently, like if I step outside the box, and the box we know is a certain shape and fits certain people, but if I step outside that box, I'm going to get the legal structures after me again. And I just wonder how have you negotiated around that? What has been your experience? It's kind of a question for both of you, but I'm going to come to Aneesa.
Yeah, I think you can still have the box in mind, whatever shape that box is, whichever model you're using. But I think it's about expanding, really, rather than kind of going into territory that's outside the scope of, your practice or your skill set. So, for example, if I'm doing, I don't know, CBT with a client, a useful way to adapt that is to, and this is a client who has a strong religious background, is to sometimes, consult with a religious leader on how they're thinking about something, or to bring in their religious scriptures and look through that for, evidence, so to speak. There can be so many different ways, but I think sometimes as well, it comes up a lot with professional boundaries too. Like we're kind of taught that, we can't go to, accept any invitations or gift giving. There's very strict rules around that. But for clients from certain cultures, for them, that's really important. And especially if you're working in a small community, a rural community, you might be the only psychologist, and you might be seeing them, around the village a lot as well. And so I think in some of the training I've done previously, we were encouraged to really reflect on if we got an invitation to a client's son's wedding, for example, to really grapple with that ethically rather than it be a strict no, that would be,
Right.
a blurring of the boundaries. But really, perhaps that would actually not be in a certain case, and it might be actually interpreted very differently by a client.
Mm.
So again, there's lots of different ways we can kind of um, stay in the box. But again, it's about that reflexivity in our thinking processes and really thinking case by case, culture by culture, what feels important to that person, and what are the ways we can connect with them in the therapy room and really build that safe space and that rapport with them in ways that might look different to reflecting feelings and doing the usual, that kind of authentic presence. For some clients from different cultural backgrounds, that can feel quite intimidating and
Yeah, sure.
scary.
Mm.
So I think it's just about that reflexive thought, really.
Yeah, and if there's an element here of what I'm hearing is that when we think about this kind of system or this box that we operate within that, has almost like prescriptions for what is ethical and what is right and what is best practice and so
Mhm.
on. I think what I hear a little bit as well is, okay, great, that's how it can look, but when we go back to first principles around things like ethics and we reflect on it, actually we can see ways in which this can also look different but still adhere within this, the principles of the ethics that we're talking about, if that makes sense.
Yeah.
Yeah, so a common one that I get just really quickly is parents emailing initial inquiries on behalf of an adult child or
Right.
a sibling or somebody else. Now, traditionally, we're taught that, it's the client, we should be prioritizing their autonomy, they're an adult. Please get them to contact me directly. Um, but in reality, like that's just not the way I approach these inquiries, because if
Mm,
I do that for people who are scared to get in touch with me themselves, they might be highly anxious. They might have just outsourced this task and really trust this family member to source them a good therapist, a
right.
psychologist. So, I always tend to be accepting of dealing with the family or a couple. Sometimes they'll come to the first session with them. And as long as the client is okay with that arrangement,
Yeah,
I'm going to pull up a chair and bring them into the room. I'm not going to be sending them out of the room if the client wants them there and values their presence. And then most of the time, it's just an initial contact, or it might be one session or two they attend. And once they know their family member is connected, is feeling supported, they're okay to be outside of the room, or for the client to come on their own. So I think that's just another example of being a bit reflexive, being flexible, and
yeah,
thinking about who has come up with these standards. Again, people from marginalized communities weren't there, developing these standards, these
yeah,
professional guidelines at
yeah,
the time they
yeah,
were being developed. They may be involved now, but at the time, they haven't changed that much. If we think about the ordering of our ethics and how we prioritize things in terms of
sure.
client autonomy at the top of the list.
And what I hear there also is people showing people showing their agency, like it's
Mhm.
their, like you're referring to their choice and the trust in the relationship that they have, and therefore bringing that in feels like a positive resource for them, which is respecting their agency to make that decision for themselves, right?
Mhm. Yeah,
Yeah.
exactly. I mean, I think clients can make the choice to have family members involved or to
Mm.
initiate, those initial inquiries.
Mm.
Um, and so I think it's important to think about how we can make it easier for them to access the services rather than create additional barriers.
I'm very mindful. I know, Melody, you joined us and you were also, this was also my fault because I got the timing wrong for us to start. And Melody, you also have to go to a meeting. So
Yeah.
I know that we're into your time and you may need to drop off now, but it's just been great hear from you and to be with you in this session. So thank you for being here.
Thank you so much for having me, and it's been wonderful to be able to be part of this. And thank you so much for sharing your stories as well. It's been very insightful. Thank you. Hope you have a
No
good rest
problem.
of the session.
Thanks so much.
Take care.
Speak to you soon.
Nice to meet you,
You
Melody.
too.
Take
Bye.
care.
Bye.
Yeah. So I'm just reflecting now about, thinking about this topic of how do we well, I'm just wondering if you can share with us where maybe kind of going into private practice has been kind of difficult, or where there's felt like there's been some sticking points, or has it been kind of plain sailing for you?
Yeah, I think initially because of the way in which I jumped ship, essentially,
Right.
I think the start of it was the most difficult for me. Again, I'm only 6 months in, so I may easily
Yeah.
encounter more challenges as I go. But I think initially it was just the adjustment of and the anger I felt around, well, I'm feeling pushed into this before I feel fully ready to go.
Mm,
Um, and so I think just kind of making peace with that and accepting that that's just the way my NHS kind of career played out, and that it would still be there if this venture didn't work out. And it's not that I could never go back. So this wasn't a permanent change, but that I needed to try something different where I really felt like I was empowered and there were
yeah.
no barriers. Because I think for me, as an immigrant child, the first in my family to go to university, and having to go through all those barriers of trying to navigate that journey to the
Yeah.
PhD and to this kind of professional role, I'd already kind of had to overcome so much, and then to encounter that in kind of my employed role, I just could not accept that that would be my journey. So I think it was a bit of stubbornness.
Mm,
And so the
mm,
initial challenges in private practice were about the fear: will I get any clients? What am I doing? This is crazy. So a lot of kind of those types of imposter syndrome was really huge for me, especially at the
mm,
start. Um, and just bringing kind of that whole, dealing with the financial aspect with clients that I'd never had to worry about before, into
yes.
things. But actually, after that initial kind of starting point, because by the time I finished, my notice period was August. So I think for the month of August, I had very few inquiries and I was starting to panic a bit. Obviously, it is
Mm, mm,
summertime,
mm.
but then things slowly started to sort themselves out. And I think since then, honestly, I rarely think about that time now. I think it's felt like this has been my therapy and my healing for me to
Yeah.
start my private practice,
Yeah.
because for so long I felt undervalued, demoralized, underemployed, being told that I was overqualified for the banding that I was in,
Right.
um, but then feeling stuck at that level, and actively oppressed, I guess
Yeah.
you could say. So by moving into private practice, now I feel like the world is my oyster again. And,
Yeah.
obviously there's constraints on what I can do and how I'm doing things. But I do feel like I've got so much freedom now to move in the directions I want to move in, practice in the way that I think is best for me and my clients. And, I've slowly come out of that whole imposter syndrome phase. And I've now
Mm,
started to just feel like I don't really think about that time anymore, because
yeah.
it's been such a transformative experience for me. And I feel like I've finally got uh, myself back, in terms of my professional
Yeah.
identity.
Yeah. Yeah, exactly. There's two things there that I'm really
Mhm.
curious about. Um, One, you raised the topic of valuing yourself. And I think for us as psychologists, sometimes for us as women, and also within that funny AI thing keeps popping up if I use hand gestures. I'll try and not use so many
Yeah,
hand
just keep
gestures.
your hands.
Yeah. I almost can't speak unless I use my hands. So,
Yeah.
I'll keep them off the screen. First thing, in terms of valuing ourselves as psychologists. Now, I don't know whether there's the same culture in Canada as there is in the UK, but as psychologists, and I think I have seen some stats for North America somewhere that, there's this thing of when professions become female dominated, it can tend to lead to a devaluing of the services that we offer. We have this particular aspect within the UK. I don't know if it's other places, but because we have universal healthcare system, there is also a tendency to almost see any kind of charging as an overvalue, like we should be able to do it for free, is kind of the assumption, right? And so that can kind of lead to us putting a ceiling on our own valuation. And then I think there are other things that I've seen is us wondering about how we can meet the needs of a marginalized group that themselves don't have access to resources because of an oppressive system. And yet, how can we charge for those services? And so I just wonder if you came across any of those struggles as you were kind of thinking about how to literally value yourself in your private practice and how you kind of work through those.
Yeah, I think the valuing bit and how to price myself really was a huge thing for me. But I do think, yeah, there is something culturally different between the UK and North America that is quite apparent for me.
Ah,
So for me, I guess maybe I didn't struggle with that as much because in Canada, um, most of psychology is private. There's very limited scope within the public healthcare system, anyways, for
mm,
therapy and for other kind of services like dentistry and other things. They've always been private, and
mm,
so I think there's a very different approach there. I think it might be considered more capitalist in terms of how people view these services. But yeah, I did struggle with it from an imposter syndrome approach, side of things. Am I adding this much value in a 50-minute session? Am I
right.
really worth that kind of money? And I think in terms of uh, working with people from different sectors and walks of life, I still do some associate work where it's
Mm,
contracted to NHS services.
yeah,
So I am still seeing a good proportion of clients who are funded by the NHS, and that provides me with a good balance
yeah,
um, as well. And I do tend to see a much more ethnically diverse group of people through that kind of pathway.
hmm,
But yeah, I think it was difficult at first. But at the same time, I think to make it viable for me to be doing this and to do it well, I had to price myself. I had to factor that in, and I had to really kind of just do it, even though I was really uncomfortable with it. And
yeah,
then over
yeah.
time, I've slowly gotten a bit more, I wouldn't say comfortable, but it's not as glaring to me that I've got that strong imposter syndrome the way I did when I first started out.
Yeah, yeah. Um, and the other thing I just wanted to ask you about is about this topic
Mhm.
of empowerment, because you've mentioned that a few times, and I can really agree with you that, in our private practices, we can get this sense of a safe base. And from the
Mhm.
safe base, we can start to feel more empowered and, start to embrace more of who we are. And the thing that, in fact, we had some kind of other podcast conversations where we've talked then about this topic of courageous leadership and, you know, a kind of role for activism and how our practices can actually be a safe place from which we can advocate for change. And I'm just wondering how you felt about that, how you've navigated that process, and what your kind of aspirations for that are in the future.
Yeah, I think, I mean, I've got some ideas of how I want to kind of take that forward, um, that are very kind of still growing in my mind.
Yeah, yeah.
So, yeah, but I really would like to
I'm
do
not going to ask you
more.
to dish all the
Yeah.
details right now, right?
Yeah, yeah. But I really would like to do more for aspiring clinical psychologists coming from ethnically minoritized backgrounds. I
Yeah.
feel like that for me is really where a big passion of mine lies, because I had to navigate so much, in the South Asian culture, the concept of a psychologist isn't even
Mm,
recognized,
right.
or it hasn't been in the past because there wasn't that kind of role. So I think the first hurdle was around what's a psychologist? What are you going to do with that kind of
Mm,
life
mm,
path? So I would love to do more with kind of aspiring psychologists who are maybe trying to navigate their own way and don't have
mm.
necessarily that kind of parental guidance either, to know that, especially if they're coming from immigrant backgrounds, that
Yeah.
you need to get assistant psychology roles, you need to get, certain types of experiences to make yourself competitive. What do you need to do to prepare yourself? Interviewing practice, but also around the racial microaggressions. I think I would love
Mm,
to do,
mm.
I think, in the future, more around that aspect of things, because I think they're so subtle and insidious, and I didn't recognize them for a while when
Mm,
it was
mm.
happening to me, that I would love to provide that kind of space where, um, even practicing psychologists from different ethnicities can kind of have a safe space to talk about those things
Yes.
as they're occurring,
Yeah.
and have the support maybe that I didn't have. I feel like I was very isolated when I went through it. As you mentioned earlier, that there can be a lot of gaslighting as well that happens, or in my case an acknowledgement that it's happening, but then because those people
Like a
haven't
big
had
right.
yeah, they haven't had that lived experience. So for them, it was very much a blase kind of, yes, that's happened, let's move forward type of thing. But there was a huge opportunity cost for me in terms of career growth, but also in terms of how it affected me in terms of my mental health at the time.
Yes.
Um, and the types of feelings it brought up in me. So if I had had a space where there was, a group or something like that, where I could see that other people were struggling with it too, perhaps there could have been a bit, I might have come to those realizations sooner, or I might have
Mm.
navigated that in a different way.
Yeah, yeah. I think, what I'm kind of learning from you and Melody and from this conversation is how important it is also to start having these kinds of conversations, right? Out on the airwaves. Um, when I talked about the concept for this series, which is healing through practice. And I remember mentioning it to someone that I know who is a clinical psychologist. Um, and I said, I think about all the different kind of lenses that come into private practice and about how it can be an empowering and healing space for us. And they said, oh, yeah, but that's the thing we don't talk about. And I just thought that was a really fascinating response from somebody, because the very clear implication is, if we're coming into private practice to heal from career trauma that we've experienced, that's because out there, that system that we're part of is traumatizing people in different
Yeah.
ways. Um, Not only that, it's other experiences that we may have had, so it's
Mhm.
not necessarily always the a career element. But starting to have open conversations, and then from that, I can't even remember where the quote's from, but it's there was a quote along the lines of, friendship starts when somebody says, "Oh, you too, that happened to you too." Where we start to build connections with people because we realize we're not alone in some of these experiences. And it helps us, other people help us to name and to put a story together and to express it. And from there, we can start a dialogue and we can hopefully advocate for meaningful change or just literally, just start practicing in ways that result ultimately in a change. I've got one last question for you, if you're
Sure,
okay
yeah.
for time, which is, what are your hopes for the future when we think about how we might dismantle some of this system of
Mhm.
oppression and how we might open up psychology to many more different lenses and walks of life?
Well, I think in terms of dismantling, I think more accountability. So,
Yeah.
and deeper
Mhm.
accountability rather than kind of this tick boxy, we've had this discussion type of, you know,
Yeah. What would a deeper
accountability.
accountability look like?
Yeah, I think actually making it a requirement or a formalization that if somebody discloses potentially experiences of discrimination or microaggressions to their manager or whoever they might be disclosing
Mm,
it to, that needs to be documented and it needs to follow a formalized procedure,
mm.
not in a punitive way, but in a way that can facilitate those conversations. As you said, that's the thing we don't talk about.
Yeah.
But we need to talk about it because turning a blind eye to it because that's not part of your lived experience,
Yeah.
it is not okay. There's a huge brain drain within psychology, and so if people feel like their only option is to leave, then you're going to get an even more homogenous workforce left in that system, and it will keep going. And so I think more
Mm,
accountability, more kind of need to kind of take that forward in a more formalized way that's not
mm,
punitive but more kind of raising awareness, in a deeper way, getting people to really reflect on their actions and holding people accountable for change, um, is important. And I think the next generation of psychologists and the skills they have to provide assessment and therapy, um, competently in different cultural contexts to people is really important, as I kind of mentioned before, on a deeper level where you're not intellectualizing or talking theoretically about kind of power inequalities and things like that, but you're really kind of grappling with it on a more reflective level as to thinking about yourself. We've all got culture bound beliefs and values and behaviors, and we can all do with reflecting on that and taking note of how we might be interpreting our clients' behavior in session. That's all coming through a cultural lens. It's really interesting, actually. A few years ago, out of the blue, I had a BBC reporter contact me because she had found a paper I had written on this years ago and was going through her own counseling
wow.
process and had had a therapeutic kind of rupture because her her issues were very culturally rooted, and when she tried to raise that with her counselor, the counselor took a very culture blind approach and said, well, that doesn't
Mm,
happen anymore, that's not relevant here. So that prompted her to go off and do her own research, and she found my paper, read it, thought, this is what my counselor needs to do,
yes.
and took it to her counselor and said, I need you to follow this and do this. And then they did that, and apparently were managed to have a really positive outcome to that process. And it
Yeah.
just really, I thought my article was there kind of in academia collecting dust, and here's this person saying that actually it changed the course of her whole life, and then that led to some collaborations with her, to kind of
Wow.
raise more awareness. So we did kind of a CDX live event during COVID, and then we did a BBC Radio 4 interview the year later called Culture on the Couch. And it was
Wow.
really nice to kind of, again, start talking about these issues on a bigger forum, a bigger platform, to really get it out there that actually these things are happening. And again, because there's so much confidentiality in the therapy space,
Yeah.
things don't get talked about. They're even more
Yeah.
secretive. And actually, what we need to be doing is raising awareness that this is as important of a competency skill for clinical psychologists and other applied
Yeah.
psychologists, therapists, counselors, that really you can't really work in a multicultural society competently unless you've actually done more than a few kind of lectures. You really have to do a more applied kind of number of sessions or placement, actually to really be providing culturally competent services.
Yeah. Yeah. And so that should be built into the way in which training is actually structured, and, that plus
Yeah.
many other things. I think one of the things that I'm really taking from this as well is how important it is to really think systematically or systemically about how we shift this system. So you've spoken to the importance of supervision and reflection, which can be together but don't have to be,
Mhm.
right? We've also talked there about the accountability and what that really looks like, and how that can be held in a way that isn't punitive but is about it's a form of advocacy for change, right? If we're holding ourselves accountable, it's holding ourselves accountable for knowing when it's not going right, when we're getting it wrong, and then having advocating for ourselves to do something about that and to make a change. I think your point there about the whole advocacy piece about how do we surface these conversations? How do we write about it? How do we engage different people in the public sphere about it? And then ultimately to just really work for those changes to be put in place. Because the other thing that is really striking me about all of this is this is not knowledge that doesn't exist, right? The knowledge that you're talking about, the cultural competence knowledge, is not knowledge that doesn't exist. We have to go and ask people about it and put it in place, but it's there. When I think about the changes that have been made recently to the legislation around providing service for adoption, I know that the adoption activism movement and a lot of the services within that and the support that adult adopted people really need is actually pretty different to what has been serviced through the adoption system that has been prescribed and mandated. Like, there is a mismatch
Mhm.
between the skills that clinicians have actually, and from from our point of view, from inside that community, what it actually needs to be. And at the moment, I mean, it's early days, I've not really seen much discussion about that, but our knowledge is there's decades of our own kind of knowledge and research and papers and all sorts of things that we could, and it's become kind of siloed because of the process of marginalization. So we need to, like, I feel kind of frustrated that all of this knowledge is out there and we just keep ignoring it. And we need to stop doing that.
Mhm. I think that's so important. Yes, because I think, with the what I've shared, that's all out there. I've not,
Right.
thought of anything new. I've not done that research. There are really eminent professors and researchers who've already published that research. It's there in the academic literature.
Yeah.
The training program I went through had a specific course in culturally
Mm.
competent therapy. And I think what we need to do is just to prioritize these skills as being just as important as training in therapy models or training in empathy and reflective listening and all the other types of training we go through in these programs. It's about prioritizing it and then listening to the people who are, as you say, the insiders as to what's needed.
Yes, absolutely. And just literally holding that question of, maybe we're not the experts on this and somebody else is, and they have things that they could teach us. Yeah.
I think that's really interesting, isn't it? To think about who is the best person to be kind of leading and teaching on this. It's usually, I find in the cultural kind of competency literature, it's people, psychologists from ethnic minorities who've had that lived experience, and then that sparks that passion to do the research in that area. So that's quite interesting.
Yeah, I was going to say, so when you say interesting, is there a kind of double-edged sword to that?
I think so, because I think, as an insider, we want to scream about this topic, right? Because we have the lived experience. It's easy for us to talk about this. But for people who are really reticent to talk about it, they're usually from that majority culture and not from one of these marginalized communities. And I get that there's a sense of fear around not using the right terms, not using the right words, not knowing what's okay to say, what's not okay to say. So it's sometimes easier just to not go there. So I guess I think it would be really interesting to kind of hear from them as to what gets in the way. What are the barriers they experience in talking about this more or doing the work themselves around training, reading? What would make that easier for them to engage with?
Yeah. I get that. You've made me reflect also on experiences we've had, which is, when I say we, within the adoption activism community, where I have even been asked. So when I did my internal family systems therapy training, I did that because I then use it in coaching. So I'm always very clear about this. But obviously at the time I was training alongside lots of other different kinds of professionals, including therapists. And so in those kinds of settings, stuff would come up and then I would share things about my own perspective. And I think people got really interested in the fact that first of all, I was a psychologist and that I was an adult adoptee talking very openly about some of these things in those contexts. And so they would ask me to then go and speak to these groups. There we go with the AI again. I'm kind of determined I won't do that. And the reason being, I feel like all that information is out there. You just could go and do the work yourself and find out.
Yeah, I think that's a really good point. It's already out there. You can just it's about prioritizing it, isn't it? And putting the effort in to go look for it rather than be a passive recipient of somebody who's done that work and is just presenting it in these kind of easy to absorb types of information.
Exactly. It takes the emotional labor off you to just sign up for a course and go and get fed some info. And then, like you say, tick the box. Oh, I'm informed
print
on
off
that
the
now.
certificate.
Exactly.
Yeah, no, that's a really good point.
Well, I could probably carry on for another couple of hours. It's been super interesting speaking with you about this, Aneesa, and also to Melody about the experience of kind of supporting aspiring clinical psychologists in this area. And I know I love the work that Melody does in that topic. I would love to hear about where we can find you on social media or the internet.
So on social media, I'm on Instagram with the handle just Aneesa Shariff PhD, and LinkedIn as Dr. Aneesa Shariff. So those are the main kind of social media platforms people can find me on, and I'm always very happy to have a chat if anyone's got any kind of further questions. And if anyone's interested in kind of some of the paper that I've written before, some of the BBC collabs I've done, you can just Google search my name and it should come up. But also very happy to link people directly to that if they just want to DM me on one of the platforms as well. But thank you so much, Wendy, for having me on. I think this is the first time I've talked publicly about my experience and transition to private practice and what drove me into it. And I was really nervous about talking about this because it's so personal to me. Usually I'm talking about other issues that aren't as close to me. But I think it's been really positive, and another step towards kind of moving on and healing from that experience. So I really do thank you for that.
Oh, it's really my pleasure. And I'm really kind of, I always feel really humble when I work with my colleagues in this area. So I thank you so much for that kind of vulnerability and for sharing that. I think it's so powerful that we speak about these things. And, just thank you so much for being on today. I also want to say many thanks to to Dr. Melody Smith for being here as well today. We'll also make sure that Melody's social media platforms and handles are in our show notes. And definitely give her a follow on social media, because the content that she puts out for aspiring clinical psychologists is just superb. I love it. I follow it all the time. So Dr. Aneesa Shariff, Dr. Melody Smith, thanks for being here today, and best wishes with everything.
Thank you.
Have you experienced a toxic workplace or felt drained, disillusioned, or isolated in your practice? Perhaps it's time to transform your professional journey. Our Practice Accelerator and coaching programs are crafted to help you create a thriving practice aligned with your well-being and values. If you're curious about what this could look like for you, visit our website and explore how we can support you in building a fulfilling and sustainable practice. You don't have to navigate this alone. Let's thrive together. Join us at inspiringpsych.com. That's inspiring, PSYCH.com.